Hi Totally and my fellow classmate. Today our group are going to present about assignment 7. My name is Dean and my groupmate is Nicole. So the question is, a 68 years old elderly who has underlying chronic renal failure secondary to uncontrolled diabetes mellitus is admitted to a local hospital for fracture after a terrible fall. So these are the laboratory investigation review. First, his serum calcium is 1.9 millimole per liter and his serum albumin is 32 gram per deciliter. More forward is that his serum alkaline phosphate is 450 IU per milliliter, and lastly, his serum parathyroid hormones is elevated. In this assignment, we're going to answer two questions. First, we have to interpret the above laboratory investigation result. Secondly, based on the above clinical history investigation, we have to explain why he sustained a fracture following a triple fall. So the keywords are 68 years old, secondary chronic renal failure, uncontrolled diabetes mellitus, and fracture after trouble fall. For the first questions, the 68 years old patient is under condition of hypocalcemia, hypoalbuminemia, increased ALP, and elevated serum parathyroid hormones, aka hyperparathyroidism. This result can be seen from the normal range. So I'm going to explain about how uncontrolled diabetes mellitus lead to chronic renal failure. First, chronic diabetes mellitus is type of diabetes that either the body doesn't make enough insulin, it can't use the insulin produced, it does not produce insulin, or a combination of both. Therefore, the cell can't take in glucose, so it builds up in the blood. High concentration of glucose will damage the capillary of kidney, which may lead to chronic renal failure if left untreated. Furthermore, I'm going to explain the normal calcium homeostasis. PTH and calcitriol combine to regulate the concentration of serum calcium. The patient is under the condition of hypocalcemia. Therefore, it triggers parathyroid glands to secrete parathyroid hormones into kidney. Parathyroid hormones is then increase the production of calcitriol. Calcitriol is transported to small intestine to increase the reabsorption of dietary calcium and phosphate into the blood. On the other hand, calcitriol stimulates the release of calcium ion into the blood to compensate the condition of hypercalcemia. When serum calcium in the blood falls back to the normal range, there is a negative feedback mechanism to stop the secretion of parathyroid hormones.
Okay, so next I'm going to explain about the hyperparathyroidism. So hyperparathyroidism is basically a condition of elevated serum PTH, and this is due to the outcomes of the chronic renal failure because now the kidney is unable to uptake the PTH. In the normal calcium hemostasis pathway, the PTH will then be uptaken by the kidney to secrete the calcitriol, in which is going to be involved to restore the calcium. So because now the patient is having the chronic renal failure, uh, all of the pathway here will be blocked. So the PTH will then be retained in the bloodstream. And PTH, the function of PTH is to replenish hypocalcemia by mobilizing all the calcium from the bone. Since now there are a lot of PTH in the bloodstream, it will then take a calcium from the bone. So the bone will then lose a lot of density, and then when the bone loses its density, it will then reduce the bone strength, and this is the explanation why the fracture is happening even after the trivial fall. So another diagram showing here, uh, when there is a chronic renal failure, it will then increase the PTH. But then, even though the PTH is increased, but why the serum calcium is still low, it's basically due to the excretion of phosphorus is depleted, because the normal function of kidney is to excrete the phosphorus. As the functional mass of kidney is dropped due to the damage or the chronic renal failure, it will then deplete the excretion of phosphorus as well. So in this case, serum phosphorus will then be retained in the high level, and phosphorus will then bind to the calcium, and the binding of phosphorus and calcium will then decrease the serum calcium even though the PTH is high. And when the another hypocalcemia is detected, PTH will then keep secreted in the high level. So for the alkaline phosphatase, um, ALP is the enzyme that are present in the both liver and the bone. Any elevation of ALP may then indicate disease in the liver or in the bone, but in this case, ALP is only limited to bone disease because high level of ALP in this patient reflects to the bone cells turnover due to the PTH elevation by mobilizing the calcium due to the bone destruction pathway. And then it also matched with the clinical scenario. In this case, the patient had a fracture. So as the follow-up result, he received a treatment and a follow-up blood investigation was performed. Serum calcium was 2.05, serum albumin was 24, serum ALP was 80. So we managed to find the corrected plasma calcium concentration in which 3.37 millimole per liter, which is fall under the normal range. And for the albumin, it was 24, but the reference range shows the hypoalbuminemia or decrease in the albumin. And we speculate that this may be due to the treatment or the renal disease progression itself. For the ALP now is 80 and the normal reference range is given in the bracket. So ALP was significantly dropped from the very first investigation, and now the ALP is fall within the normal range. Okay, so that's all about the comment, and this is all the references, and thank you very much.